Warning! The footage you are about to see contains cancer patient with no makeup and may be disturbing to some viewers. Your discretion is advised, yeah?
Oh, hi there, mother cluckers. Okay, that's enough of that. So where have I been? In bed. Asleep. A lot. I've missed you. It's currently March 13th, 2023, and I have completed 5 cycles of chemotherapy. Chemo fatigue has really kicked my ass recently. After like the 3rd cycle, it's been kicking my butt. Makeup can't help me anymore. I have permanent bags under my eyes even though I sleep constantly. So this is what you get. I'm tired of trying to color in eyebrows when half of them don't even exist anymore. See how splotchy these little bad boys are? These guys are hanging out for dear life though. I've been very delicate with them. I do have some eyebrow tattoos coming in the mail today, so maybe that's in our future, just to see how terrible I look with tattooed eyebrows. I'm not allowed to get actual tattoos because of, you know, my immune system. My 6th treatment will be the last of the hard stuff. So I'll explain a little bit more later on that, but let's just say we are getting close to the finish line. I can see it, it's in my future, and I'm so excited. I had my 5th round of chemo last Monday. You know, symptoms are still the same pretty much. After my 4th cycle, I started tamoxifen. Tamoxifen is not my friend. I don't think it's anybody's friend. Tamoxifen is a hormone blocker, basically. I'm triple positive, so because of that, they have to put me on tamoxifen to basically block my hormones because they feed my tumor. And it also pushes menopause. So I am going through menopause at 35 years old. The hot flashes, fuck that. I am honestly a little glad that I'm living in Maryland right now, because if I was still in Texas experiencing these hot flashes, I'd sleep in a freezer like a morgue. That's morbid. I can't, I'm gonna put it, yeah. Yeah, tamoxifen sucks, and that I have to take for the next 5 years. Yay! I had a consultation with my breast surgeon the other day, and I asked her, I was like, so what about after I finish tamoxifen? Will all of a sudden, magically, I'd be, you know, back to how I was? And it's up in the air. I believe it was the chemo that killed my ovaries. I no longer have a menstrual cycle. I stopped having one pretty much after round 2. On top of that, because my hormones are so out of whack, I've put on some weight, man. Everybody thinks cancer, you know, you lose a bunch of weight. Not hormonally. For me. Not for me. Because of my hormones. I'm a chunk monk. I do have some good news. I had another breast MRI, which I gotta stop for a second and like, just, if you've never had a breast MRI, you don't know what dignity feels like. It's glorious.
Oh, hi. Didn't see you there. Dr. Tawdry Chocha, how you doing? MD, by the way. So today we're going to go over a breast MRI. Strap in, relax, and get your panties out of a bunch and be prepared to be amazed by the wonderful world of breast MRIs. Here at Chocha Medicine, we like the state-of-the-art equipment. Today I'm going to bring in my assistant. Assistant, please come in and lay down on this beautiful machine. As you can see, this young lady is suffering from a hemorrhagic contusion. Now that she's laid on the machine, I'm going to wheel her into the machine. Now I get to check her vitals. All right, so once in the machine has a big rack full of MRI stuff, and it does crazy magical things in the background. Meanwhile, our patient has subtly laid her booby breastises, and that's a medical term, over both ends of the panel here. And then we would like to come over to the side and gently place them into the proper order so that we can start the machine. Beep, boop, boop, boop. Now your MRI breast examination is over, and we've come up with wonderful results. Here at Tawdry Chocha's Medical Center, we love taking care of our patients. We also like to give you quality service every day. I'm a doctor.
Doc, please. Can I get out? Please. It hurts. No.
So anyway, I had another MRI and we got good news. The chemo is doing what it's supposed to be doing. Hans Gruber, the booby tumor, has shrunk significantly. I can barely even feel him anymore. He's like an itty bitty little dude. My last treatment is March 27th, 2 weeks from now. I'm super excited. I mean, I'm not excited to get another round of chemo because it sucks, but I am excited to be on my last one, sort of. After that, I have to do immunotherapy, which is the last 2 chemo drugs. So Herceptin and Perjeta, I believe. Those do not have near the side effects that the first 2 bad mama chemos do. So I have to do, I think it's 6 rounds, another 6 rounds of the HP after my surgery. So one thing I'm super excited about regarding the immunotherapy infusions is that I won't have to do steroids beforehand, and I won't have to do the Neulasta injection either. So no more bone pain, and the steroids won't keep me up like crazy. At least I think that's what I was told. So surgery. Surgery currently is not scheduled yet, but we are in the works of figuring out more where that's gonna be than when. So they want me to have surgery the beginning of May, early May, so it works out perfectly if I'm to have my surgery in Houston at MD Anderson. I'll be in Houston April 29th for a wedding, so if I can get in with MD Anderson, it's in the works right now, then I'm gonna have my surgery there. So the surgery that I'm having is a double mastectomy. I could do a lumpectomy with radiation, but the risks involved with the cancer coming back, I never want to do this again. That's for sure. So if I can take every chance to not have it come back, I will. So I'm getting both my boobies chopped off and reconstruction same day. I am not getting implants. I am going to use my own fat, which I have plenty of now. D-I-E-P, DIEP. I think my doctor was just saying DIEP. In a DIEP flap, fat, skin, and blood vessels are cut from the wall of the lower belly and moved up to your chest to rebuild your breasts. The other option is tram flap, and that's getting it from your back and moving it to the front. Because it's my own fat, you know, my body's not gonna reject my own fat, it's already mine. And also it will fluctuate with my weight like natural boobs do. So if I gain weight, they'll gain. If I lose weight, they'll lose. And I fully plan on losing when I have enough energy to work out. There is a procedure, it's a nipple sparing mastectomy. I'm not doing it. I can't. I could. Too risky. Where my tumor is located, it is so close to the nipple. If I kept it, it would just be asking for trouble. Like, it is right under the skin, and that's why I was so lucky to feel it, is because it is so close to the surface. If it was any deeper with the grade and everything that this tumor was, you know, all the triple positive, I could have gone without knowing until it was like a stage 4. So I'm really glad that it was where it was, but that also means I'm gonna be nippleless. So I do know already that there are plenty of tattoo artists that will tattoo nipples. My girl Nikki Jo, shout out, whistle, is just gonna be doing, I'm not gonna tattoo a nipple, I'm not even gonna try that, because I have the one tattoo on my right side that kind of goes from my hip up almost to my boobie actually. Oh no, we might have to clip her wing. Hopefully not. I'm gonna see if my surgeon can avoid clipping her wing. If he does, you know, Nikki's gonna be tattooing my boobs whenever I'm allowed to. So between 2 and 3 years after my mastectomy is when I'm allowed to get mastectomy tattoos. So yeah, that's where I'm at right now. I know I said I was gonna keep all this like happy and positive, and I am, and it's still happy and positive, and but I need everyone to know that it's still real for me. Like, I am losing everything that essentially makes me a female. Not my vagina, don't be stupid. I know some of you are gonna make those comments. I've lost my hair. I've lost my ability to reproduce. It wasn't in my plans anyway, but having something else take that away. Yeah, and now my boobs. It is what it is. I mean, sitting here crying about it's not gonna change the outcome. If I wanna live to a nice old age, I gotta do what I gotta do. But even though I joke and I laugh and generally stay as positive as I can about it, it is still real to me. Anyway. So if you got this far, congrats, you got to see me cry. That's the only time it's gonna fucking happen. Until I'm in like a lot of pain after surgery, and then I'm gonna be crying like a bitch. That's all, folks. Damn it.